Today we are talking about all things a beautiful smile, teeth whitening, teeth alignment, gummy smiles. And joining us in studio are our experts, very sought after, well-known reconstructive and general dentist, Dr. Wim de Beer. Welcome, Dr. Wim.
Oh, thanks, Cindy. It's awesome to be here.
And the very well-known and our own personal favorite, cosmetic dentist and aesthetic doctor, Dr. Zak.
Always fabulous to be here, guys.
Welcome, gentlemen.
Welcome, gentlemen.
Thanks so much.
Wow. If your doctors look like that.
I mean, you can trust it's going to be amazing results.
It's going to be good.
Oh, thank you. That's so kind.
Let's start with teeth whitening. Dr. Wim, what are the teeth whitening techniques that you are recommending at the moment? What is trending? And what do you love to do the most for teeth whitening?
For me, the process that has stood the test of time in our practice for almost 14 years is the in-chair bleaching from Zoom made by Philips in conjunction with the home bleaching kit from Opal Essence for maintenance. And it's been flawless and as good as whitening can be for many, many years.
Exactly. So when you come to the waterfront, the V&A, we've got the lovely two oral hygienists, Naz and Benita, and they are just absolutely wonderful. So whilst you're having your teeth whitened for 2 hours, roundabout, during the process, she will also be manufacturing you a home kit. And that is for your maintenance at home. We normally use the Opal Essence home kit. So it is also a wonderful product that not only whitens the teeth, but also strengthens the teeth as it releases fluoride. So, for example, when we are talking about people with very sensitive teeth, the Opal Essence is a great alternative because you can whiten the teeth at home for a shorter duration of time and at a lower concentration. And in the same procedure, getting your teeth stronger and adding luster to your fantastic smile.
So what do you avoid then after you've done your whitening? Because I've had whitening done. I actually lost one tooth during a hockey incident and had to replace with implants, yes.
Really?
And then I had to match up these two fake teeth to get a kind of same color tone.
Isn't it fascinating? I believe all four of us here today all had Bluetooth before it was discovered.
Yeah, long before.
I mean, mine was from the rugby injury back in the days when I was playing rugby and Bismarck du Plessis was my hooker. I mean, I was so straight they could have called me Butch James.
I'm going to stay out of this one.
Yes, absolutely.
So what do you avoid? Because, I mean, I love me a bottle of red wine.
Okay, so the big thing is it depends on which whitening process you're going to take.
Okay.
With the in-chair whitening that only lasts about 2 hours, you only have to avoid pigment-containing foods and drinks for about a day or two afterwards.
Oh.
If you're going to go the home bleaching kit, it takes about 2 weeks to get to that level of whitening. And then you're going to have to avoid those things for about 2 weeks.
Curry, red
She's
wine,
in chair only.
Yeah.
ketchup, anything that can stain a white shirt.
Okay.
Because what happens during the whitening procedure is the fact that the dentinal tubules open up and there's an exchange of ions. So during the process, your tubules are actually exposed and susceptible to anything that can stain a white shirt.
Okay.
Is that also why it's painful? I mean,
Yes.
for some people it's more painful and for others it's less. Talk us through that process. Why is it painful and how can you avoid it?
During the whitening, in order for it to be able to penetrate into your tooth, it needs to dehydrate and to a certain extent demineralize your tooth. And that opens the nerve, figuratively speaking, to the outside world. But your
In a
tooth
very
is
safe way.
in a very safe way. That's where you want to take or use professional oversight in doing these procedures. So your tooth is in a constant state of demineralization and remineralization. So that's why it reverses as well afterwards. So your tooth can remineralize itself and then it will go closed, and then after a day or two you don't have the sensitivity anymore.
So when your teeth have cracks, you will also see that it's more sensitive to whiten the teeth. You may have to have them filled and the cracks restored before you have them whitened. And on the note of the fact that the teeth kind of dehydrates when you have the procedure done, that is temporarily. So, for example, when you have your December holiday, automatically your teeth appear to be whiter, and that's because of the dehydration. And as the teeth rehydrate again, they become darker again.
Don't dehydrate your teeth. Like mouth breathing is very bad for your oral health. It's bad for your gums, it's bad for your teeth. If your teeth are dehydrated, they're very susceptible to rotting and caries and staining even more.
Yeah.
So so to dehydrate your teeth is not a good thing if you want to do it on your own. Do it with professional oversight.
I've had such a journey with my teeth, and having braces as a child, having too many of my teeth removed because in the old days they used to remove so many of your teeth and then made less space in your jaw. Yeah. But also one of the things that caused was for me to do mouth breathing. So as an adult, I've actually had to teach myself how to nose breathe again. By consciously going to sleep, putting my tongue on my palate and focusing on breathing through my nose, and I've actually taught myself to breathe through my nose when I'm sleeping.
It's a great habit to have.
It's such a great habit to have, and it makes such a big difference.
You've actually been doing mewing. Yeah. And it kind of works. But did you know that 80% of our children suffer from narrowed upper jaws? And that has an effect, a spiraling effect on the rest of the overall health. Because of the fact that the jaws are too narrow, the breathing is affected. People snore more. It leads to sleep apnea. It even leads to sinusitis, chronic sinusitis as an adult, but it can also even affect your blood pressure. So the orthognathic system is not just a system on its own. It communicates with the rest of the body. So it's very important to make sure that we stimulate our jaws as children to enable us to carry our permanent teeth, so that we don't have to sit in a situation where we used to be, where healthy teeth are removed in order to create space, which is absolute bull, because as we know now, every single tooth carries a function. With nerves and with blood, it is connected to some dermatome in the rest of the body. So we need all of these teeth, not only for our aesthetic, but also for functionality, because the teeth carry the function of support. It supports the upper lip. If the teeth are in the correct position, we look optimally beautiful. And it tells us something about the intricacy of our design, of our DNA. If we as dental professionals enable our patients to be optimally functional, we also enable them to be optimally beautiful. And I think that is something really beautiful about the way that we are designed.
Yeah, function follows form and form follows function. If you put the teeth in the correct positions, you will get aesthetics.
And how do you keep that functionality if a patient opts for veneers?
So we use the veneers to perfectify the teeth. So if the teeth do not carry the ability to be whitened only, if the whitening is not going to work, then we utilize other strategies, for example, veneers. And that will give us a more consistent color. We can choose and determine the color. We don't want to go all Nicki Minaj nowadays.
Yeah.
So we're opting for a more beautiful aesthetic and something that looks natural.
Yeah.
We don't want our friends to tell us, oh, you've got beautiful veneers.
Yes.
We want them to say, oh, wow, you've got a beautiful smile.
It is a real art to get. Denise and I have both had our gums done with you, Dr. Wim. And we know what a big difference that makes. I had a very gummy smile.
I had a very gummy
You
smile.
had a very gummy smile. Tell us about that for people that don't understand the changing of the gum line.
Everything starts with a diagnosis at first. This is where we really use AI and good quality photos to determine what exactly a patient needs. Because not all patients need a gummy smile reduction with laser. They could maybe need aligners, or we determine if the position of the teeth are correct or not correct for optimal aesthetics. This really helps us tailor-make a specific plan for each specific patient. Now, in your guys' case, laser was the allocated minimally invasive way of improving your gummy smile. There's unfortunately also limits up to where we can reduce the gummy smile, and that's determined by our diagnosis. So if we can at least, in most cases which I've seen, if you can just reduce it by a millimeter or two, it already makes a massive difference, like with both of your smiles. If
Even
there's any
side
more
profile,
needed,
it's just like
yeah, so
You
if
guys
there's
look
any more needed,
fantastic.
other
Yeah.
plans must be made in terms of aligners, moving the physical teeth.
I think what Wim is also saying is very, very true. Minimally invasive dentistry has become the Bible of aesthetic medicine. So if we are going to opt for veneers, we will first make sure that the teeth are perfectly straight. We are not going to be doing some form of a turkey teeth makeover where we cut away all of the natural, healthy tooth structure. We will first of all straighten the teeth, then we will whiten the teeth and make sure that the teeth are optimally white. And then the patient can decide, listen, I want an even more perfect smile, like most of us want.
yes.
And then, okay, so now you've whitened your teeth. What is the process after that? How do you maintain those white teeth and how long does it last?
The best way of maintaining it is really through bleaching trays at home, just to give it that extra oomph it needs when you see it's discoloring. Also, very good habits to have is to use a straw, preferably a paper one, and always keep water with you. For example, if you're out the evening having dinner, drinking wine, just keep a glass with you that can neutralize, or just drink a glass of water after your meal that can neutralize all the acids, the sugars, and the staining pigments that you've just had. But the most important part is not to leave it on your tooth overnight. That's why brushing in the evening is so helpful.
As the last thing that you do, it doesn't help you
Yes.
brush and then you drink something else
Yeah.
before you go to
Yeah.
bed, because
Correct.
then that sits on your
Yeah.
teeth, even if it's a cup of tea.
Yes.
But you do want to wait at least 30 minutes after the last time you've consumed any sugar, because the sugar causes an acid in your mouth. So if you're going to brush your teeth within 30 minutes, you're going to cause some acidity in the mouth to proliferate, and you're going to actually harm your enamel.
And speaking of toothbrushing, what do you recommend for people who can't get around to professional teeth whitening? What do you recommend that you can do at home or over-the-counter products?
I mean, I always say that your teeth are your pearls and your body is your temple, Shirley Temple. So we want to keep our teeth healthy and we want to make sure that we don't harm them. So if you can, if you really want to make them whiter, have it professionally done. But there are some treatments that you can buy at Clicks and over-the-counter products, such as a CBD toothpaste. You can use activated charcoal, although that's abrasive. We don't want any
Why
abrasive.
is it abrasive?
Because it is abrasive.
Okay.
Then we'll tell us
So
more.
the whitening mechanism it uses isn't really whitening. It's a scraping mechanism where it
wow.
just clears off the stains from your teeth. But in that sense, it actually scratches your enamel.
So initially it can look nice, but it can harm the enamel over the long run.
And all over-the-counter products, the danger with that is there's no oversight. So misuse can happen, and overuse is where the problems with whitening start. So people must be aware that whitening can be overdone. So if you choose to take a product from Clicks, just stay with the manufacturer's instructions and everything will be okay.
Yeah.
There are also whitening strips that you can purchase. They'll never be as effective as your professional whitening.
Of course.
And always, take into consideration the fact that there are limitations. So every smile is unique.
Is it ever too late for you to change your teeth to get the perfect smile? I mean, I think I came to you to get my braces done when I was 40. And it only took 9 months because when I was a child, I didn't wear my retainer, so they moved back. And for me, at 40, I was given the gift again of my perfect bottom teeth. So is it ever too late? What is the oldest patients that you've treated?
Well, you actually came too soon, Sindels, because nowadays we could do it in as little as 3 months with the new Spark clear aligners, much quicker technology, clear braces without any train tracks on your teeth, without anything cemented onto your teeth. So you can just take out your aligner when you eat and you brush your teeth. So it's so simple, and every week your teeth become more straight and your face becomes more beautiful because it is facial-driven orthodontics. So it's not only about just a perfect smile. We want the face to befit the beautiful smile. You're never too old. If you want to install more confidence into your face, my oldest patient at the moment is 84 years old.
No way.
And
Shut
it
the front door, call Charlie and tell him we're done.
Well, she looks a lot younger, but I think it's absolutely incredible to see how it is affecting her confidence, you know?
I want to ask, because you guys are you've changed my confidence completely. What was it about your profession that you guys wanted to tap into this? Like, what made you decide that this is what I want to do? Because I can tell you, it changed me. Like, I have so much more confidence than I did before my procedures with you guys.
It's difficult to imagine you have more confidence now. I've got America on the line.
So what was it for you guys when you went, okay, this is what I'm going to do, this is the career I'm going to go and tap into?
I actually just wanted to do something that's unique, because most of my friends wanted to become lawyers and chartered accountants, and I don't like being one of the crowd.
Yeah.
So I purely looked for something that's unique and cool.
And I just wanted to fix my own face. And that's actually the truth. So I've used my face as guinea pig to really fix it. Because, you know, I had a dish face as a child. I didn't have a dish face. I was born with a beautiful, beautiful face. And, you know, my mom, she never lied. She always used to tell me how pretty I am. And I kind of believed it and I knew it and I had the confidence. But when my hard tissue was inhibited by the fact that premolars were removed, healthy teeth were removed, eventually my elasticity levels caught up with me because, you know, you need the hard tissue support. So eventually I did end up with a little bit of a Pac-Man face. So I was very intrusive and you couldn't see my teeth when I smiled, really.
Oh, wow.
So I had to figure out how I'm going to fix myself. And if you fix yourself, you learn from it and you get to then help other people. It's my absolute passion to install people's original beauty, the way that they should look. Not to look different, but to feel confident in your own skin.
It works, so thank you.
Well, Dr.
thank
Vim,
you.
Dr. Zak, you definitely do instill a lot of confidence in people and change their lives.
Oh,
so
thanks,
you can be
Sandor.
very chuffed with the profession that you've chosen. And it is cool and different, Vim.
Thanks.
You achieved that.
Once you go Zach, you never go back. Once you go Vim, you can skip the job.
Thank you, everyone. That's it for Beauty Talk this week. See you next time.